My name's Leslie Cousland. I'm one of the clinical studies officers with Enrich Scotland, and I cover the Tayside area. I think I'm really interested in Rich Voices because Enrich itself, one of its main priorities is to support and engage with care homes around a research agenda. And I think involving people who have lived experience or people who have just got an interest is one way to move that agenda forward.
Hi, I'm Martin. I should actually be in a care home now, not as a member of staff, but as a resident. My physical symptoms are too bad, but the neurologist has said that the research I do is actually keeping me out of the care home. So when I actually do go into the care home, I'd want to carry it on.
Hi, I'm Anna Bryan. I'm a researcher, PhD student at the University of Edinburgh in the Advanced Care Research Centre. And I thought I'd join this group because my research looks at the use of music in care homes. But I'm interested in how we can involve the whole community of people and stakeholders involved in care homes and getting perspectives from staff. So I think also just getting to sort of meet the group, be a part of this and learn from it, and also be able to chat about my work would be great.
Hi, morning everyone. My name's Jenny Robertson and I'm also from the Advanced Care Research Centre at the University of Edinburgh. So my role is for patient and public involvement and engagement. So obviously I'm very passionate about involving members of the public in research, and we know that care homes are a kind of under-researched area. So I was really pleased to see this group get set up and keen to kind of spread the word and get more people involved in research. Thanks.
My name's Emma and I'm a practice development nurse with the professional practice development team NHS Tayside, based out of King's Cross Hospital this morning. But I have a remit as part of my role for supporting person-centred practice in care homes in Perth and Kinross. I suppose I was interested in this because I'm interested generally in research. I'm just about to go and do another master's module with Queen Margaret University, and I'm interested in research and where it comes from and how it informs practice going forward, but also just like many others that have already alluded to, just hearing those voices of those delivering the care and receiving the care that we're providing is really key, and sometimes they're the difficult voices to hear. You tend to hear from those who have a bigger platform. So I'm just really interested to see what work we can do and how I could contribute from it and learn.
Hi everyone, my name's Maria Drummond and I'm the Senior Clinical Studies Officer at Enrich Scotland. I'm interested in Rich Voices because when I was a PhD student at the University of Glasgow, I worked with community members who helped support me through my research, and I know the value that it adds. So I'm sure that it'll add so much to care home research in Scotland.
So my name's Anne Morrison. I work with the Dementia Liaison team in Angus. So I work for the NHS, but we support care home nurses to look after people with dementia. And my interest in this group is because I think there's a vast amount of work out there that care home nurses are doing that's probably going under the radar and not recognised. So I would be really keen to get the work that they do in care homes with people with dementia recognised for what it is.
My name's Claire Cameron. I've worked in dementia care for about 10.5 years, all in care homes. I've been a nurse and I've also managed care homes as well throughout. So I've worked, in quite a lot of settings and things as well. I've seen lots of changes throughout the years as well in care and what we are doing as well. So I think it's really important for groups like this to spread the word about all the really good practice that we're seeing, the challenges that we're facing as well, not just, and for the residents to get their voice out as well, because it's really important, and we are advocating a lot on behalf of those residents, whether they really need to have their own voice as well.
I do think that's going to be one of our biggest challenges, and probably, if it can work, one of our biggest successes is we can get more voices from people who are living in care homes and finding different ways to promote that engagement.
My name's Jeanette Barclay. I work for East Ayrshire Advocacy Services. The reason that I was really interested in this, I go around the 18 care homes within East Ayrshire and I attend their residents' meetings. And my role primarily is to make sure that their voice is heard. So that was why I was really so interested when I read, the remit of the group.
I'm here as part of Enrich team, and I support Enrich with research governance, which is really boring. By the same time, if you are to unpick it, it allows care home. As we all know, it's such a unique environment, and proper research governance allows us for many projects to happen if it's put in place, because integration, as it happened in Scotland, care home probably is the best example of health and care staff meeting together, working on common grounds, trying to find the best way to support residents and their families. It's that important that research in care homes is demystified, and we can only start by demystifying the community itself, because we have, unfortunately, Scottish Government they have done a lot of good work, but they have done a lot of bad work, and we have to accept and reflect on that. And social worker was saying it's the best place for him to be at home. Well, no, it's not, and it's demystifying and doing all this work. The best place is the place where you want to be, and the best place is where it's best for you to be. So I think, I'm here to support that demystifying of what care home is, trying to engage with the workforce in a dignified manner, knowing how busy and how overworked they are, and what is there for that workforce. What is there? Why would workforce want to take part and give their precious time away to participate or support a research project?
What jumps into my head would be, as a starting point, demystifying what care homes and residential homes and nursing homes are all about. We have to spend a long time just explaining what care homes are about and what, and how they operate. So I think that's within my own practice development team. So I think there's some work to be done there. So it'd be nice to see something that focused really strongly on just educating.
I think you're absolutely right. It's changing what everybody's concept of a care home is. I'm actually quite ashamed to tell you this. When I started this job 4 years ago, I didn't really have any idea of what a care home was all about. And when I went in and these people were having parties and they were going out on bus trips and out for coffees and everything. And when I speak to people about care homes, they think it's the end of the road. But it's not. It's a completely different new chapter in their life, and it's the most amazing thing, supporting people moving from home or hospital, getting into a care home, and you see a massive improvement in them. This wee lady asked me 4 weeks after getting into a care home if I could take her in lipstick, and that was just amazing, where she had no interest in her appearance before. And you're right, it's seeing the staff and the interaction. And I went to a residents meeting yesterday, and this gentleman was saying, all these people here are my family. And it really touched me. It's like a wee community within itself, and it's trying to break down the barriers and getting people to understand what a care home is actually about and the advantage it has to individual people.
If I go into a care home and I get sat in front of a telly, I'll be challenging behaviour straight away, because that's hell to me. Having worked on the shop floor of a care home as a care assistant, those of you who go around care homes, what you should be looking for is the person that will go the extra mile for the residents. I'll be in a care home within 5 years, but as long as there's Wi-Fi in that care home, I would expect to carry on co-researching like I am now, basically, to be honest.
We need to engage with care home staff and families more at grassroots level. There's so much we could do, and we do need to kind of rein ourselves in a wee bit, I think, and just take it a step at a time.
For me, it's just basic communication, whether it be technology or whether it just be speaking. I think that's what the problem is. It's just trying to get the word out to everybody.
I think time is always always an issue for, you know, for anyone everywhere. And to explore that with people in care homes is probably the way ahead with that. It's not about me saying, well, this is how we could fix that, because it's not. But also getting the information and the misconceptions. You know, a lot of people perhaps, you know, who work in care homes, care assistants, chefs, gardeners, people who do lots of different roles, won't have, may not have, so I'm not going to say won't have, but may not have an understanding of what we mean by research in the first instance and how they can get involved. So
I would say most of the shop floor workers, as I call them, do not, I mean, certainly 6 years ago, they weren't, certainly didn't know that you could do research. I didn't know you could do research.
The word research can sound really intimidating to some. It's not clear what that really it can maybe have connotations of scrutiny involved in and amongst that. So I think there's so many people looking to do work with and to and among care home organisations that I think we've got to have a USB. There's got to be something that really sells us as what the care home sector can expect to get back. So I think that's the key, is what is it going to be in, and not in for society as general, because they're just working this firefighting mindset at the minute, that what is in that for the actual care home that wishes to get involved, and that's every stakeholder within that. What can they expect to see out of this? And I think that communication, I agree completely, really important. And I think we can't overestimate the importance of listening. So communication, thinking about that as not as how we're communicating and how we're selling this and talking about this and explaining it, but really how we're listening actively and really deeply to those and their concerns and addressing those questions honestly as well.
Scottish Government guidelines are very heavily against sedating, what I call a chemical course. And if I didn't do research or have some meaningful activity, and I mean age-appropriate meaningful activity, I would have to be sedated. So that's the answer. You're following the Scottish Government guidelines, basically.
When I worked in care homes, I didn't, like you, didn't realise that research was something that might happen in a care home or with residents or staff, but could never have found the time to do anything like that in my spare time as like a young student working really hard, and my shifts were my weekends, my weekdays were being a student nurse. And for me, what I see care home research is like trying to build that into practice and prioritise it. And when someone has a cancer diagnosis now, it's quite like normalised that you'll hear people be involved in new treatments or part of trials, and it's quite a positive frame that's put in, and it's something to talk about, and it's something quite exciting. Yeah, so that's what I'd like to see, like residents and staff having similar opportunities to other diagnoses and other groups in society, and that it is part of what's likely or expected when you get to that stage or you have a certain diagnosis.
One thing that might be a barrier to getting like the diverse range of care homes that are out there. So maybe like some care homes that are more well-resourced might have more capacity to participate in research. So making sure that we're finding ways to engage with all like care homes, and also in different geographic areas as well that might have less accessibility. So thinking about the types of like, I guess, convenient sampling that sometimes happens in research and how we can sort of push past that, but it is like a barrier that I think will probably be faced.
Just one other little thing that just jumped into my head, really. I think also bearing in mind the idea that these are businesses and that they have reputations to uphold and what have you on a very local level. So I think it's kind of not spinning it, but if there's this, they're cutting edge, they're leading, they're helping with research, would be really, you can see the appetite for that among a business that's looking to, sort of showcase what they do. If there's any sort of suggestion that something's not working right, therefore research team are coming in to see how that can. So I think it's just, again, it's just about the language, isn't it? And how, and getting into the mindsets of some of the small businesses, and what's in it for them might be that their care home will stand shoulders above the rest because they look as though they, and they are rightly so, and they're actively engaging in this and helping the sort of what's going to happen in the future. So I think maybe that's just, again, around language.
Once I'm in a care home, you'll be bombarded with practical suggestions.
Whether we call it research and how we kind of get people to understand what that actually entails, and the huge range of research. You know, Maria was talking about the kind of clinical trials and the fact that as a network we have lots of clinical trials, but we also have, you know, there's interviews, there's surveys, there's observations, there's all these other ways of gathering information that aren't maybe as well publicized, or the value of them is maybe not as well understood. There is so much kind of engagement and passion just in this group alone, to try and change what research looks like from a care home perspective.